Welcome to the Medical Excellence Center. Today's lesson is about understanding the sample mnemonic in emergency conditions and/or trauma.
Introduction. In emergency medical situations, especially in trauma cases, time is critical. Healthcare providers often use mnemonics to quickly and systematically gather important patient information. One such mnemonic is SAMPLE, which stands for signs and symptoms, allergies, medications, pertinent past medical history, last oral intake, and events leading up to the illness or injury. This lesson will delve into each component of the sample mnemonic, providing a clear and detailed explanation to enhance your ability to recall and apply this method during emergency assessments.
S stands for signs and symptoms. Definition.
Signs are objective evidence of disease or trauma observed by the healthcare provider, while symptoms are subjective experiences described by the patient. Importance. Understanding the signs and symptoms helps in diagnosing the patient's condition and setting priorities for immediate care. Key points to gather. Ask the patient to describe their pain or discomfort. 1. What is the intensity, location, and nature of the pain?
2. Look for visible signs like bleeding, swelling, or discoloration. 3. Check for signs of respiratory distress or altered mental status.
A stands for allergies.
Definition.
An allergy is an abnormal reaction of the body to certain substances called allergens.
These can include drugs, foods, environmental agents, and more. Importance. Knowing a patient's allergies can prevent life-threatening reactions, especially when administering medications or other interventions. Key points to gather.
Inquire about common allergies, example, penicillin, peanuts, latex. Ask about previous allergic reactions and their manifestations, example, rash, anaphylaxis.
3. Note any use of allergy tags or bracelets. M stands for medications. Definition.
This includes any prescription drugs, over-the-counter medications, herbal supplements, or home remedies the patient is currently taking.
Importance. Medications can influence the type of emergency treatment given, interact with new medications, or explain some of the current signs and symptoms. Key points to gather. 1. List all medications along with their dosages. 2. Determine when the last dose was taken. 3. Understand any adherence issues or recent changes in medication. P stands for pertinent past medical history. Definition. This encompasses any previous medical diagnoses, surgical history, or treatment that might be relevant to the current emergency condition. Importance. Past medical history can provide clues to the cause of the current condition and influence the management plan. Key points to gather. 1. Focus on chronic illnesses such as diabetes, heart disease, or epilepsy. 2. Note any recent hospitalizations or surgeries. 3. Ask about the outcomes and complications of previous treatments. L stands for last oral intake. Definition. It refers to the last thing the patient ate or drank before the onset of their current condition. Importance. This information can be crucial, especially if the patient requires surgery or if intoxication or poisoning is suspected. Key points to gather. 1. Determine the time and content of the last meal or drink. Consider how this could impact their current medical condition. Example, a full stomach during anesthesia. E stands for events leading up to the illness or injury. Definition. This includes any significant events that occurred before the emergency situation. Importance. Details about what exactly happened can help in understanding the cause of the injury or illness and in formulating an appropriate response. Key points to gather. Ask about the circumstances surrounding the injury or onset of illness. Example, a fall, ingestion of a substance, exposure to toxins. 2. Note any environmental factors or activities that could have contributed. Conclusion. The sample mnemonic is a powerful tool used by emergency responders and healthcare providers to quickly gather essential information about a patient's condition. By thoroughly understanding each element of sample, you can improve your assessment skills, potentially leading to more effective and timely medical interventions. Remember, in emergency care, every detail counts. Thank you for learning. Join us and enjoy more of our services.